being aware that you've had an injury and continuing to monitor it and getting the help whenever you feel the effects of that in the military is important. The stigma has been really worked on to reduce the stigma. I mean, we really have done major progress. It's changed dramatically in the last 20 years in terms of the thing that people are most concerned about. Will it affect their careers? Will it affect their security clearance? Will it do any of that? They really have changed that. Part of that is by having leadership that when they're injured, they bring it out, they announce, they talk about it, and they really reassure the troops. There still are a number of folks, though, that really don't want to mention anything while they're on active duty. It is really important, though, as they transition out of the military, that they make their interviewer aware of that. If they don't do it while they're in the military, go to the Veterans Administration. That's what they're there for, to take care of service members after their service. That is their mission. They're there to help. And we request, I mean, from the active duty side, that you get the help you need whenever you need it, because you'll be a better soldier, a better support for your family if you do.